You mentioned about reaching out to the poor more and giving them services to uplift their lives. Now, your new tagline for the department is boosting universal healthcare via Formula One Plus. Now, sir, how will the department go about this tagline of yours, considering that providing universal healthcare is not very easy? It's not been done yet in the Philippines.
Well, it's a moving target. It's a vision that we would like to realize. But the difference today is we've set for ourselves a timeline.
Okay.
It's really DOH providing the pathway towards health for all by 2030. And of course, there will have to be some kind of vision-based camps, which I will need to suggest to the EXICOM of DOH, that perhaps we can be because the vision is like this, it's a global leader in providing healthcare financing, equitable healthcare financing, more responsive health system, and better health outcomes, with the mission of providing equitable or guaranteeing equitable, sustainable, quality healthcare for all Filipinos, especially the poor, and to become a leader in the quest for excellence in health. Okay. Now, those are the big the vision and the mission with the core values of integrity, excellence, and compassion. What I would like to suggest is really to have a vision-based camp. Say for 2022, we want to be the ASEAN leader in providing the three: equitable healthcare financing, a responsive health system, better health outcomes, and therefore improve quality of life.
So, sir, is this a given that you are supporting the proposed universal healthcare bill?
Well, I haven't really reviewed the provisions of the said bill, but the concept, as I have been told in general terms, seem to be okay with me. So we will be able to intelligently comment on it after my technical working group shall have seen the contents or the provision.
Sir, budget will be a big issue once we implement universal healthcare. You have previously served in PhilHealth before, and I think the criticism then was the government only provided about 500 million pesos when for the program to work and to really serve indigent Filipinos, you needed 6 billion at the time. So are you a little bit more confident now that there will be budget for universal healthcare should it push through, especially since you have a 2030 timeline going here?
That's right. Well, let me just set the record straight. During my time when I was PhilHealth president, in 2010, when I stepped down as secretary, the coverage of PhilHealth then was 86%.
Okay.
And if I remember right, the budget to subsidize the premium contribution, the membership of the poor sector, poor segment of the population, was about 5 billion. Not 500 million, but 5 billion pesos.
5 billion.
Yeah. It was close to that, about 4 or 5 billion, thereabouts. So today, we have the benefit of the same taxes being, proceeds put into the PhilHealth to continue the enrollment, to sustain the enrollment of the poor segment of the population and the not so poor. So we have a total of about 45 million beneficiaries.